Hundreds of women gathered at the Endoactive conference on May 16th in Sydney to listen to the shared perspectives of people who suffer from endometriosis and professionals who treat endometriosis. Endometriosis is a condition resulting from the appearance of endometrial tissue outside the womb, causing pelvic pain, especially during menstruation. While 1 in 10 women suffer from it worldwide, many people do not know the full extent of the often debilitating symptoms associated with the disease.
Maybe you were 20 and you've had painful periods since you were 12, but you also now have irritable bowel, food intolerance, headaches, overactive bladder, bloating. You might have pain on movement and achy pain, stabbing pains, painful sex. But there's all the rest of it as well. What about the fatigue, the nausea, the anxiety, the sweating, the dizzy, the low mood, the poor sleep? I think this is the big picture of endometriosis.
Sharon Jarvis from the Women's Health and Research Institute Australia explains how muscles in the pelvic floor are affected by the occurrence of endometriosis, which can cause pain.
So the muscles don't really contract or relax and stretch well. They can wind up a bit. You're sort of sitting up in this contracted state, up on the third floor. Your brain normalises this because that's what it feels like for you. But in fact, these muscles might be a little bit wound up. They become tight, tense, bulky. They can become painful when they contract a lot. Plus or minus, you might have trigger points in those muscles that might be locally painful, or those trigger points can refer pain out. It can be on both sides or one side. And this all then leads to difficulty with bladder function, so difficulty passing urine, and sometimes women can have pain, and difficulty opening the bowels and evacuating circulation, and it can lead on to constipation, and some people have pain. But from a vaginal point of view, if you have a reduction in vaginal function because of pelvic floor muscle overactivity, it can lead on to intercourse pain, so either inability to manage penetration at all, or inability to manage complete penetration, or inability to manage movement. You might not be able to get tampons in or out. Pap smears might only ever be able to be done with a tiny speculum or under GA, and you might have extreme difficulty with examinations, ultrasounds, and sometimes if you need to do stretches, you might have difficulty with dilators. And if it's intercourse that's the main painful issue, then that might lead on to avoidance, psychological and relationship issues, and then you can also have lots of other external abdominal, pelvic, and sort of hip muscle issues.
Rachel Favreau was 16 when she was first diagnosed with endometriosis and is familiar with these symptoms.
My period always used to put me in bed. It would, I couldn't function. I would know the second it arrived because not only was I in pain, all of the energy just leached out of my body. I was at school this one morning and I thought I was fine. I'd had my period, and so I'd had a couple of days off school, but I'd gone that morning because I thought I'd kind of gotten over the worst of it. But this one particular morning, I ended up on the ground in the classroom. I literally could not get up. I couldn't even, they tried to walk me to the nurse's office so that I could be more comfortable. I couldn't even get up. The pain was so debilitating. It was awful.
Rachel says that if women are experiencing the same kind of symptoms, they should seek professional help.
If your period is so debilitating and it lands you in bed for days and it causes disruption in your normal life, then you should absolutely go and see someone about it because it's not normal.
Charlotte Sterling for Between the Sheets.